Hello, and welcome to Let's Talk Aging. I'm Gwenyth Johnson with Second Wind Dreams. We are an organization dedicated to changing the perception of aging. And through this series, we will talk with people who are dedicated to that very same thing. Today, we are lucky enough to have with us two members of the Georgia Public Health team, and public health from two different perspectives of the system. So please help me welcome Elizabeth Head and Jennifer Harrison. Welcome.
Hey, how are you? Good to see you.
It is wonderful to see you. I'd like to ask you both to just do a brief introduction about yourself and then about your part of public health here in Georgia.
Sure. So my name is Liz Head. I'm the Deputy Director for Injury Prevention at Department of Public Health. We're at the state office, so we work with state level partners, and we are occasionally lucky enough to work with local partners on in health departments and other local community organizations to get the work done. Specifically, I work on fall prevention, driver safety for folks over the age of 55, and most recently, dementia and Alzheimer's disease sort of prevention and care type of work.
Fantastic. Jennifer.
Yes, ma'am. My name is Jennifer Harrison. I am the charge nurse and a nurse practitioner here at the Emanuel County Health Department in Swainsboro, Georgia. Not only do I oversee the clinic and its operations, but I also see patients. We are very blessed to be working with Miss Elizabeth Head in a grant right now with the BOLD grant, and we are delighted to be moving forward with trying to integrate telehealth and dementia and Alzheimer's works into our clinic flow.
So what types of outreach and programming are you currently working on? You mentioned the dementia work and the telehealth, and I'm very curious about that, and I know our listeners will be as well.
Absolutely. So when we received this funding from CDC, we titled our grant the Be Seen Project because we want to build our largest dementia infrastructure. That's the CDC acronym. But we also want to do that using kind of a systemic approach. So systems using education, evidence, and networks. Most of all, we want Georgians to feel seen and to be seen in the care that they need and the care that they're providing to their loved ones. And as individuals are traversing some sort of diagnosis around dementia or Alzheimer's disease, what that means prior to diagnosis and what that means after. And that's just a lot of like our umbrella framework that we say. But at the end of the day, we're looking at getting into faith-based communities and working with them to make sure that they feel as though that they can care for their community of loved ones. We want practitioners to feel more comfortable talking to their patients about what it may mean if there's some cognitive decline. Maybe you don't remember things like you used to. Sometimes that's stress, and sometimes that's something more. And being able to have that conversation to advocate for yourself as a person and say, hey, doc, we need to talk this out. But once you have that conversation, knowing that there are resources and doors that you can go to get answers and find care, that's what we're ultimately trying to do. And we do that with amazing partners like Jennifer Harrison at our local health departments. They are a window into a local community. And we're so fortunate to work with her and be able to add on to the amazing outreach that they already do.
And kudos to you, Jennifer. This is a full service public health clinic that you're running, and you are taking on these additional things. Yes. How might the public get involved or reach out to you to experience some of this?
Well, it would be best if they could call our local clinic. The office number is 478-237-7501. They can ask to speak with me, Jennifer Harrison, and I can direct them in whichever direction they need to go, whether it's with trying to get themselves or someone screened for dementia, Alzheimer's, or if they need to get set up with primary care, or if it's a caregiver who needs some resources, materials, or even linkage with maybe a support group or even some type of counselor. So we are diligently working here to try to get all these resources together and ready. So I would be the best point of contact for right now.
That's wonderful. And what an amazing array of things that people can reach out to you for.
Yes,
Kudos.
absolutely.
This is fantastic. I'm so proud to be part of this state with you all. I'd like to ask each of you individually, how do you change the perception of aging?
So it's a really great question. For me, I embrace what's happening as I age. I take one day at a time. Just recently learned that it's not a scratch on my glasses. I'm soon to have bifocals, friends. And I'm okay with that. It's such a glorious time to be comfortable with myself and the lessons I've learned over time, and to apply those to the work that I'm doing, to my family, and to the adventures that I choose to take on with my family and friends. So it really is just embracing these changes and learning about them, just like I've learned about everything else as I've gone through life.
Wonderful. Jennifer, how about you?
Yes, so I feel the same as Miss Elizabeth. I try to embrace every day. Aging is a natural process that is going to occur whether we like it or not. My approach is that we try to head off and conquer things before they occur. I myself am very passionate about mental health, and I have experienced some memory issues that have really just brought it to light for me. So, you know, I feel like there's others out there who have the same concerns as I do, where they're not sure if they have an issue or not. And I'm hoping that with all the dementia and Alzheimer's work that we're doing here at the health department, that we can help our patients with navigating through their questions and concerns, and providing education and knowledge to them to reassure them through the normal aging process.
You all are amazing. And I feel so very lucky to have been able to interview you both today. I'd like to thank you all, and I'd like to thank our audience. Please tune in again for Let's Talk Aging. And